Well, hello, and thank you for viewing this program that I've entitled The Dangers of Candida. Now, I want to explain that for many, this may seem like an over dramatization because I've talked about the dangers of Candida, and indeed there truly are. And my goal or my purpose of sharing this information with you is to make you to realize just how impactful this particular type of condition in your body may be. So as we get into this, I first want to welcome you then, and thank you again for joining me in viewing this. And during this presentation, I would like to discuss everything with you that I believe you need to know about the Candida overgrowth and the natural ways that you can go ahead and perhaps heal your gut. My name is Dr. Robert Bartosh of Proactive Wellness and Injury Center, and this is my goal. My purpose is to educate so that you can become better equipped in your responsibility of remaining proactive, enabling you to enjoy the best performance of your life. And you do so by hearing the truth regarding various situations. So let's go ahead and find out the truth about Candida. What is it in fact? And I want you to know that our bodies host a variety of organisms, including bacteria and fungus. And Candida is a particular species of yeast. It's normally found in small amounts in the mouth, in your digestive tract, and on your skin. This is where it's normally seen. And when it's present in small amounts, the body still can thrive and still maintain its healthy purposes. However, in the right environment, or the incorrect environment, perhaps I should say, yeast can multiply and it can grow out of control, and it can lead to a condition called candidiasis. Now, according to the Centers of Disease Control and Prevention, there are over 20 different species of Candida yeast, and they can cause an infection in the humans. And the most common one, of course, is Candida albicans. Now, there are three types of candidiasis, and they include Candida infections of the mouth and of the throat and the esophagus. This is many times it's called thrush or oropharyngeal candidiasis. Then there's another type that's known as vaginal candidiasis, and the third type is called invasive candidiasis. And this occurs when the Candida species enters the bloodstream and spreads throughout your body. Now, this can happen when you have a Candida infection that continues to procreate or populate the body, and it becomes stronger and stronger and stronger until it finally bursts through your gut and it becomes bloodborne. Then it becomes what's known as invasive candidiasis. So, some of the common species of candidiasis or candida are the Candida albicans, which most people are familiar with, and the tropicalis, the glabrata, the parasipolis, and the cruciae, and the lusitania. So those are the typical types of Candida that most people in the United States are affected by. So what I'd like to do now is to take a closer look at each of those that I mentioned. And the first we'll begin with is probably the most well-known. That's the Candida albicans. And this is a species that's responsible for over 50% of all the candidiasis that occurs within our society. It's a very opportunistic yeast in nature, meaning that this yeast is going to seize the opportunity to overgrow, and it will eventually wreak havoc in various parts of your body. Now, the environments, or the environments in which Candida albicans thrive include a compromised immune system. It means basically that your immune system has been weakened and it's not functioning at its fullest potential. Also, low counts of beneficial bacteria in the bowels that are due to antibiotic use, or high stress levels, or excessive sugar intake, or hormonal imbalances. And untreated, this particular form of Candida overgrowth can lead to systemic infections via the bloodstream. Remember, I said a few moments ago that if it gets stronger and it overpopulates the body, it can break through and get into the bloodstream, and it's going to create an environment for numerous disease processes to simply occur. Now, some of the common symptoms of this particular manifestation of Candida are fatigue, bloating, flatulence, anxiety, depression, vaginitis, itchy skin, impaired memory, poor concentration, foggy brain. So this is quite a severe manifestation, if you will, and it affects many, many different areas, or it can express itself in many different ways throughout your body, much of which has been misunderstood and or misdiagnosed by other physicians. Because when an individual comes in with a foggy brain or poor concentration, or perhaps vaginitis or depression, or the bloating and that, it may be erroneously diagnosed as a digestive problem, a hormonal problem, oh my gosh, a hormonal imbalance, and the individual then is given all these various medicaments to treat these effects, when in fact it's all stemming from a yeast infection. And that, as I said earlier, the Candida albicans, and which is the most it's not the most popular, but it's the most experienced, I should say. It's affecting and it is responsible for more than 50% of all of the yeast infections that the society is experiencing today. So now we're going to look at the tropicalis. Now, the tropicalis is noted as the second most common species of the yeast involvement, and it's believed to be responsible for over 30% of the Candida bloodstream infections. Now, overgrowth of this species has also been linked to the nervous system disorders resulting in depression, anxiety, headaches, memory loss, and many of the individuals are most susceptible to overgrowth. And these individuals that are most susceptible to this type of overgrowth are people who have type 2 diabetes, who have leukemias or lymphomas. Now, this type of overgrowth usually occurs in the gastrointestinal tract and on the skin. Understand now, this usually occurs in the stomach and on the skin. So many of these people are taking these proton pump inhibitors, whether they be the Lexium or the Prilosec or whatever is on the market now over the counter, and they're erroneously treating themselves for a problem that they're not really dealing with in their pursuit of trying to take care of the effects. Now, some of the common side effects of this particular yeast infection include diarrhea, excessive gas, stomach cramps, skin irritations, like relentless itching or eczema or hives even. So you can see that how this can be misconstrued by many of the sufferers when they're thinking that they have some other type of problem, when it could be the Candida tropicalis that's stemming up and becoming more powerful in their system. Now, this species of Candida is becoming much more resistant to antifungal drugs, and it makes it very difficult to go ahead and to treat. Another one that we experience in our society is the Candida glabrata. Now, according to the National Institute of Health, the mucosal and the systemic infections caused by this particular yeast have increased significantly due to the growing use of the immunosuppressive drugs and the agents that we're using. This species also is responsible for about 10 to maybe 30 to 40% of the Candida infections, and it typically manifests or can cause what's known as oral thrush. Now, thrush can affect anyone. I want you to know that. However, it is most frequent among babies or toddlers, and even some of the older adults and or people with immune deficiencies. And if it's left untreated, this thrush or this expression of this type of yeast can spread to other parts of the body, which include the lungs and the liver of those who have their immune systems compromised or weakened. So again, you see, I go back to that initial slide where I entitled this The Dangers of Candidiasis, because there are many, many things that can develop and result as the offshoot of a yeast infection that's not taken seriously or is overlooked and is confused for something else. Another one that we see often now is the parasyphilis. And the parasyphilis is involved in about 30% also of the candida infections, and it includes the nail and the tissue infections as well as the fungal blood infections. Now, some of the symptoms that are common among these types of individuals include severe flu-like symptoms, chronic fatigue, systemic infections. Now, this particular species has a very high resistance to antimicrobial drugs and has even become a cause of concern in many hospitals throughout the United States. And you can see here how this can be confused for some other type of disease when the person presents with flu-like symptoms, or they're experiencing chronic fatigue. That's fatigue that's been going on a long, long time. They just have no energy, or they have other types of systemic infections. You see? So as we move on, let's look at the Cruciae, or the Candida lusitaniae. Now, these species of yeast, they admittedly are more rare, with each one accounting for maybe about 1 to 2 or 3% of the yeast infections that many people are experiencing. Now, the Cruciae in particular is usually associated with infant diarrhea and sometimes systemic candidiasis. So it can come on with the oral thrush or the cradle cap in a baby, or it can, instead of being the thrush, it can be the Cruciae, which is affecting the infant, and it usually shows up as diarrhea or some other type of infectious process that's going on in the baby. Now, the Lusitaniae, though, has been linked to several cases of candidemia, or blood infections, as well as the systemic candidiasis, and it can include sepsis or pyelonephritis, which is a potentially serious kidney infection. Now, these, again, are not to be taken lightly. And as I said earlier, they are certainly overlooked or not even recognized by many people that are experiencing these symptoms that I mentioned, not even thinking that it's possibly a yeast infection that's causing them, but it's some other type of disease process. So we've got to ask ourselves then, what causes the Candida overgrowth? Well, there are a lot of reasons that the yeast can grow out of control in your body. And if you have, many of which that we're going to touch in this presentation, but there are 3 here that are the major contributors of developing a yeast infection in the body. And these may be quite surprising to you. One of which is the consumption of beer. Another is the consumption of sugar. And another one that is really coming on strong and is affecting more people than they realize is the ingestion of kombucha tea. Now, I know that, you may be aware of the kombucha tea, and you may even be a person that's been told to go ahead and drink this for different types of conditions, because it does afford some benefits to the health. However, what many people don't realize is that the amount of sugar that is in the kombucha tea, and the amount of sugar in the beer that I mentioned, and also the sugar itself, which is in the standard American diet. And we're going to be looking at this a little bit more closely. But some of the other factors that can promote the Candida overgrowth in the body are taking antibiotics. And unfortunately, we live in a time period where many in our society are going from one antibiotic to another, to another, to another. And what that simply is doing is breaking down their immune system. It's compromising their intestinal flora. It's killing off a lot of the good bacteria, and it's feeding and fueling the bad bacteria and the yeast that's in the bowel. Also, eating a diet that's high in sugar and refined carbs. And as I said earlier, many people in our society are consuming what's known as the standard American diet, which is very high in sugar and refined carbs and very low in good quality proteins. So this is also contributing to the the influx or the increase in these yeast infections. As I mentioned, high alcohol intake, the beer, which is included, which is probably the foundational alcoholic beverage that many people are consuming, as well as the mixed drinks and the wines and whatnot. This added to a weakened immune system, people taking oral contraceptives. And the oral contraceptives today aren't just being merely used to prevent birthing from happening, or impregnation, I should say, but also many practitioners are prescribing oral contraceptives when a young lady presents herself with an acne problem or skin lesions or whatever. Oftentimes they're put on a contraceptive, and this is gone from one contraceptive to another, to another, to another through many years of their life. And it does result in the breakdown of the intestinal flora and the increase of the yeast in this particular individual. As I mentioned earlier, also type 2 diabetes. Many of the diabetics that we have seen in our practice have also been showing a concomitant manifestation of a severe yeast infection as well. And also in our society, the high stress levels that you and I experience on a daily basis. And this is not just relegated to adults, but we have our young people. They are under a lot of stress, their peer pressure with the social media and whatnot, how it contributes to that, the poor diets, the use of the contraceptives, and on and on and on it goes. So you see, all across the board, we are presenting with what's called the perfect storm, if you will, and it's just a tremendous opportunity for the yeast to proliferate in our bodies and to show up in a lot of various diseases and symptoms as well. So the gut health is a major influencer here on various instances and illnesses, and it's true here when we're dealing with Candida. So what we want to do then is to take a closer look at our gut microbiomes. These are the bacteria and the entities that inhabit our bowels. Now, according to who it is, regardless of who it is you're reading or what research you're privy to, there's around, agreeably, there's around or more than 100 trillion. I didn't say million, I didn't say billion, I said trillion. That's a whole lot. 100 trillion good bacteria that live in and on our bodies, and most of which can be found in our gut. In fact, our gut is really swarming with all sorts of microbiomes and microbes and various types of bacteria. Now, a healthy gut has a balance of the good and the bad bacteria. And the good guys are the beneficial bacteria that help to enhance our health, like probably the most popular of which most people are aware of are the probiotics. But it also should be noted that a healthy balance is considered to be a balance of about 85% or more of the good guys and about 15% or less of the bad guys. And as long as you're maintaining that balance in the gut, then the body's immune system is going to be stable, it's going to be powerful, it's going to be expressing its potential, and you're going to have a pretty good response each and every time any type of bacteria or virus would be coming your way. But know that the beneficial bacteria is needed to help your body to break down the food that you've eaten to make it available for the body to absorb the nutrients from the food. And when our gut is out of balance, however, the bad bacteria coming from various sources like your food or your environmental toxins or even stress, they start to take advantage, they quickly multiply, and that's when the harm is experienced by your body. Now, I want to stop and say that there are a lot of people that are living on proton pump inhibitors like the Prilosec or the Nexium or the whatever antacids. You've got to realize that the acid, that the way the good Lord made us is that the acid in our stomachs is there as not only as a digestive entity, but it's a protective mechanism as well. Because unbeknownst to the consumer, when there's a lot of bacteria, viruses, parasites, all kind of nasties that are on the foods that we eat. And when it gets into the stomach, even the chemicals that are put on our foods, when the food gets inside the stomach, the acid there that is present is able to kill off a lot of these bacteria, these viruses. It's able to disarm some of the chemicals that we're eating. So it's there for our protection. And when these people are taking these things that are reducing the amount of acid in their stomach, these antacids, then the body loses a defensive mechanism, and these bacteria, this yeast, these fungus are allowed entry or access into our bodies, and we typically eat the same foods over and over and over again. So you can see then very clearly how these things can go ahead and take advantage and quickly multiply in the body and go ahead and wreak havoc. Okay, so the question now is, what kind of havoc do they wreak in the body? So these are some of the common symptoms of Candida. And there are many signs that you may be suffering from Candida. So what I want you to do is, this is what I call my symptom mirror. So because many people have things that are going on that they misconstrue for other types of conditions, I want you to just think about yourself right now and see if you can see yourself in this symptom mirror, because it could be very well that you are experiencing a kind of a yeast infection that is perhaps getting stronger and stronger in your body. So these are some, not all, but some of the primary symptoms that your body may be showing you that are going on, that your body is wanting to make you aware of the presence of this yeast overgrowth. Okay, so here are some of them that are the persistent intense sugar cravings that you may be experiencing here, and also cravings for processed carbs such as bread or pasta or pastries. You just got to have it. I know there's a restaurant in the area where people run to and they want to eat there, and the first thing they eat are the buns or the rolls that this restaurant makes, because they're so sweet and filled with yeast and they're so tasty. Well, when you have these types of cravings, that could be a warning signal. Also, brain fog or anxiety and bouts of depression, the mood swings and the irritability, provoked for absolutely nothing. You can't put your finger on why you're depressed or why you're angry or why you're going through these mood swings. It could very well be due to a yeast infection that you're experiencing. Also, vaginal yeast infections, and they include like the itching and the swelling and the discharge that you have, or poor focus and concentration. Developing new food sensitivities or allergies or intolerances to food. You're going along through life and you can eat this particular food, and then you hit this wall, if you will, where you're eating this food, but now you're getting sick, you're getting indigestion, you're not able to tolerate it. It could be that it's due to a yeast infection. Or you look in the mirror, you stick out your tongue and you see a white coating on your tongue, thinking that perhaps you're having staph or strep or some other type of invasive entity there, when in fact it could be a yeast infection. Digestive issues, as I mentioned before, like the gas or the bloating, constipation, diarrhea, or even a lot of mucus that you see in your stool. Skin issues like acne, eczema, even psoriasis. It could be stemming from a yeast infection. Itchy ears, low libido, unexplained fatigue or exhaustion. You're in your prime of life, and doggone, you get out there to do some yard work and you do a little bit and you just spent, you're exhausted, you got to sit down and take a break. It could be coming from your gut as a yeast infection. Also, skin and nail fungus infections, canker sores, or the flu-like symptoms that I mentioned earlier. And the worsening of these symptoms, they usually exacerbate or get more intense, or get worse, if you will, in cold and damp weather, or in humid, hot weather. because what happens is these types of weather conditions, they encourage Candida to spread and to grow. And this can aggravate all of the symptoms that you are experiencing. So again, I want you to focus and to look at yourself in this symptom mirror. And if you're seeing these types of symptoms, if you are experiencing these types of symptoms, it could be very well that you have a current yeast infection that's going on that you didn't realize up to this moment. Okay, so now that we know some of the symptoms, let's look at some of the conditions that can result from having a yeast infection. Okay, now these are some conditions that are associated with the Candida. One I mentioned earlier is the oral thrush. This is the yeast that overgrows in the mouth, and it causes that white coating on the tongue, or it can cause bumpy lesions or redness or pain in the mouth or the throat. And some of the severe cases, actually, if they're left to continue, they can spread into your esophagus, and they can cause pain or difficulty when you're swallowing or when you're attempting to speak. Now, having a weakened immune system is commonly associated with the oral thrush because the body is not able to stop this from happening. It's very weak, and the yeast continues to gain in number and strength. So it just overrides the body's mechanism to protect itself. Then another condition is the tiredness and the fatigue. Now, these are among probably the most common symptoms for several reasons. There are nutritional deficiencies that the individual has, in particular, many of the B vitamins, and also the essential fatty acids that the person probably isn't eating if they're eating the standard American diet. And magnesium, also a deficiency, probably one of the main deficiencies in the United States experienced by a majority of people, the magnesium deficiency. So when you put those all together there, those usually promote the proliferation of the yeast in the body, and then that expresses itself as tiredness or fatigue. And then another one is a recurring genital or urinary tract infection. Now, listen, there are a lot of females now that are seeing their doctors for a ongoing or repeated urinary tract infections, and they're being treated with antibiotics and antimicrobials, all of which are going to feed and fuel the yeast. And here it could be that it is a yeast infection that is resulting in this urinary tract infection over and over and over again. Now, please understand that men can get yeast infections as well, but it's much less common than the estimated 75 to 80% of the women who experience at least one vaginal infection in their lifetime. And you know, if you have one and you haven't eliminated the cause, then you're destined and doomed to have recurring infections over and over and over again. Okay? Another condition might be the digestive issues. Now, when remember I mentioned the balance between the good and the bad bacteria in the bowel. When that's impaired, the individual usually experiences digestive issues, which include the diarrhea, the constipation, the nausea, the gas, the bloating, the cramping, all of that nasty stuff. And it's not truly a digestive problem. It's a digestive effect that's coming from or stemming from a yeast problem. Also, sinus infections, these long-lasting, maybe people at work or whatever, they have these long-lasting, ongoing chronic sinus infections. Doesn't matter what season they're in, they just can't kick it, and it may not be bad all the time, but it's always there. We've even seen some individuals that have come to us in the past who have had nasal reconstruction because they were told that their nasal passages were too small. That's why they were having the sinus infections, and that they had to have those expanded, only to find out that the surgery was not beneficial to them, and they're still having the problems. And then many of the individuals have been given the antibiotics, that are commonly prescribed for sinus infections. And we know that these antibiotics are actually destroying the gut, and they're promoting the yeast, which could be resulting in the sinus infection. And then, as I mentioned, the skin and the nail fungal infections. You know, skin is naturally covered in a bacteria. Good bacteria are on your skin, and it's there to prevent the candida from growing uncontrollably. However, you know, there are many products today that people are putting on their skin that contain these antibacterial ingredients. You see some of these individuals, they're almost germophobic, if you will, and they're constantly applying these antibacterial salves on their skin and putting it on. And what's happening is they're killing the good bacteria that's on their skin, and that's opening up the door, and eventually they get this itching or this visible rash on their skin, which are two very common symptoms of a skin fungal infection. And it's all a result of putting these chemicals on their body and breaking down this barrier that they had, see, to protect them. So these are some of the more common conditions that can result when a person has an unrecognized yeast infection. Now I want to graduate or show you how the candida can graduate, and it can promote or result in illnesses. Remember my first slide, the dangers of candida. These are many of the dangers of candida, nothing to be taken lightly, especially when you have this overgrowing in your body and you have your immune system being weakened. It opens the door then to various illnesses. Now, I want to share with you some information here in this regard, because research has found that an overgrowth of candida is many times associated with diseases of the gastrointestinal tract, and that includes what's known as leaky gut syndrome or intestinal permeability, also ulcerative colitis and Crohn's disease. And we're seeing an alarming increase in these types of disorders, or I should say these illnesses that are being experienced in young people as well. We're also seeing an increase in eczema, even autism. Some of the research is showing us that because of the gut flora, because of the imbalance between the good and the bad bacteria and the proliferation of the yeast in the gut, the types of autism are being experienced in young people, and of course fibromyalgia. Now I want to hit you with something that you may not realize, and one of the more serious, and I hate to relegate illnesses as less and more and whatnot, but another illness that you may not even think about that we believe is linked to candida is cancer. Researchers for years have known that bacterial and viral infections cause several types of cancers. That is a fact. And there's current research today that is looking closely at the link between cancer and fungal overgrowth. And there are many today that believe that there's a connection between the cancer and the candida. And I, for one, am in that group as well. And this is what we're seeing. We have more work against cancer and whatnot than ever before. We're seeing more and more cancers that are showing up, and we have more and more people that have these yeast infections that are going on into this. So allow me then to explain this connection to you. Okay, so we want to progress here and show you here that there is a cancer and candida link. There was a Nobel laureate in Denmark that proved that there was a connection between cancer and the fungal overgrowth, and he did this back in 1913. In 1913, this individual won a Nobel Prize for his research that was showing, and his name was Dr. Jonas Fibiger of Denmark. And he did this back in 1913, showing a direct link between the yeast and cancer. Now, allow me to continue here because there was a comprehensive study. This was back in 1950 where the Lacanau Hospital Research Institute and the Institute for Cancer Research, they revealed their findings, and they showed that there was fungi present in virtually all. Listen to what I just said. They, in their research, showed that there was fungi or yeast present in virtually all, and all is an absolute term, in all of the cancerous tumors that they examined. In absolutely every one of the cancerous tumors that they looked at back in 1950 in their research, they showed that there was fungus that was present. Now, the coexistence of cancer and candidiasis has actually been well documented over the years. In fact, a doctor by the name of Tullio Simonici, he is the author. If you want to get this book, it's called Cancer is a Fungus. He pointed out that at most, the basic level cancer and yeast fungus, they have a very similar, if not, they share identical characteristics. And one, if you want to look at it this way, one is the youngster, that which is the fungus, which then grows and becomes the adult, which is the cancer. So this is what he stated. This is what the research has shown us, that both cancer and candida feed on sugar. If you want to keep yeast alive and you want it to multiply and increase in your body, then you feed it sugar. If you have been diagnosed with cancer and you want to keep that cancer alive and well in you, and you want it to get worse, then feed it sugar. And also, both grow. Both the cancer and the candida, they both grow and they reproduce only in anaerobic environments. That means they both grow and they both reproduce in environments that are low in oxygen. This is one of the reasons why in our center we've been using hyperbaric oxygen therapy for over 20 some years, and because of the patients that we see. But we realize that yeast and cancer, you can stunt or stop their growth, and you can actually kill them by infusing or increasing the oxygen amounts in individuals. And they both need an acidic environment to survive. So this is another reason why we look at the pH level of the individual, because in a pH environment that is acidic, then the cancer and the yeast can go ahead and not only reproduce, but they can survive and they can multiply. And this is unbelievable. So I just want to stop for a moment and look at some of these things here, because where do we see most of the individuals, or what gender I should say, do we see most yeast manifestations? It's going to be in the female. What gender is most concerned about their health? It's the female. What gender is using the antibiotics more than the other, or the antimicrobials more than the other, or is on various types of drugs for depression, for birth control, for acne control, and it goes on and on and on. You see where I'm going with this. It's the female. Also, most of the females, I shouldn't just say the females, but most people in the United States in particular consume what's known as the standard American diet. And that is the consumption of a lot of sugar and a lot of refined carbohydrates. In conjunction with that, they're also drinking some chemicals like aspartame or NutraSweet, these artificial sweeteners, because they're concerned about gaining weight, so they drink these diet drinks or these other drinks. You put this all together. Now, let's proceed. So we have this kind of an environment that promotes it. Also, before I forget, as I mentioned earlier, they live in a low oxygen environment. So we have a lot of people today in this gender that are sitting. They sit at work, they sit to get to work, they sit at home to eat, they sit at home when they're being entertained or whatever it might be. So they're sedentary primarily. So we put that together and they're experiencing this yeast explosion that they're not even aware of. Now, let's continue with this gender. And I ask you, who has more problems, who has more heart attacks than the other gender? It's the female now is number one in heart attacks. Who has more cancer manifestations or expressions than the other gender? It's the female with the reproductive types of cancers, and they go on and on and on. Is it any coincidence? I don't think so. I believe that there is a direct correlation. This is why I go back to saying that, look, these are the dangers of Candida. It's a small fire that once it's lit in the body can become a raging inferno that can destroy that body, starting out as what many consider as innocuous yeast infections. And if it's left undetected, if it's allowed to continue to grow and grow and grow, it might very well develop into cancer. As a matter of fact, going back to Dr. Simonici, he stated also that Candida in his clinic, in his research, is found, the Candida is found in 97 to 98% of the cancerous tumors that he finds in his patients. That is these are statistics that we can no longer ignore, that I want you to be well aware of, because understand that your health is your responsibility. And the more you know, the more truth that you act upon, the better the chances are for you to enjoy the best performance of your life. Okay, so let's move on then to Candida and sugar, because I've talked about this before. Because the Candida albicans in particular, and that's kind of the basis, that's the foundational Candida that affects the vast majority of individuals. In particular, it has a very high affinity for glucose. That means that the Candida organisms, they need sugar. They love sugar. That's why you have these cravings like the glucose and the fructose and the high fructose corn syrups and the sucrose to provide them with the energy to grow. That's how they grow. That's how they multiply. And additionally, the sugar enables the Candida yeast cells to switch. They change in their morphology. They switch to their more destructive fungal forms. It's like they graduate, they ascend the ladder, if you will. And this results in faster growing Candida, and it leads to the leaky gut syndrome. This is where the yeast then bursts through the gut and it gets into the bloodstream, and then it becomes systemic or global. I've got to stop here for a moment, because back in the 1980s, a few years after I was in practice, and I've got to tell you, and I'm not boasting in any way, shape, or form, I'm just sharing with you some information. Back in the 80s, yeast infection was in the same category as hypoglycemia. And many doctors were poo-pooing that, saying it didn't exist, or the chronic fatigue or the Epstein-Barr. There was quite a few of those different conditions. And they were denouncing even the existence of these types of conditions, one of which was yeast infection. There were a few doctors besides myself, and we got together. There was a lab that we used. It was back in Norman, Oklahoma. I will never forget it. They were the only lab that was doing testing for yeast infection at the time. And doing this, I had a patient that came to me. She was a student at a university in our area, and she was sharing with me that her sister was institutionalized, and she was diagnosed diagnosed with schizophrenia. So bad it was that, as I said, she was put in an institution. Well, we talked about it, and I'm a believer in the human body and its potential, and I just believe that it's been fearfully and wonderfully made, and it's more than up to the challenge. And if there's something that's going on, there's got to be a reason, basically, for every effect. And I'm the kind of a person that wants to find out the reason, because if I can find the reason and eliminate it, then the body can go ahead and do what it was designed to do, and that is to be well. Very long story, very short. She brought her sister up to me from Lubbock, Texas, where she lived, and I did my investigations. I did my exam, my blood work, and all of the testing that I do. And I found out that she had a very severe, and when I say very severe, I mean it was very severe yeast infection. So severe was it that it had broken through what's called the blood-brain barrier. She had a systemic yeast infection that had gotten broken out of the bowels, got into the blood, went to the blood, into the brain, permeated through the barriers of the brain, and that resulted in the schizophrenic type of effects. So what we did was we found out what was going on. We eliminated the contributing factors. We cleared it out. And the young lady today, I still get postcards from her. She's married. She has 3 children. She's enjoying her life. She's no longer diagnosed as a schizophrenic. She has all her normal capacities. But the point of all of me sharing that with you was here she was being treated for schizophrenia, and it was coming from a yeast infection. This is why I went back and I entitled this The Dangers of the Candidiasis, because it is extremely dangerous if it's not recognized and it's allowed to continue to proliferate in the body. Okay, so getting back to this, the candida and the sugar, there's some researchers that firmly believe that the rise of cancer rates over the last 80 years could be due to the modern standard American diet that's very high in sugar, very high in the low fiber carbohydrates. You know, that many people are eating the processed white sugar, the refined flours, the high fructose corn syrups, and other foods with very high glycemic counts. And that feeds the yeast fungus and it causes it to rapidly grow. And this leads to a disruption in the normal healthy balance of the good and the bad flora. It compromises and lowers the immune system, and the yeast grows up and it moves from being a teenager to an adult, where it becomes an expression of cancer. You know, as I've already illustrated, the yeast overgrowth is linked to a poor immune system. And when you combine it with these refined high sugar consumption rates, it's no wonder that we're so sick. And it's no wonder that we're seeing the increase in cancer, even though they're raising all this money and it's in the genes, and I really don't adhere to that type of thinking. There's something that's changed, and what's changed is our environment and what we're putting into our bodies from our environment. Anyway, that's my stance on this. As a matter of fact, back in 2011, there was a study that found that carbohydrates were indispensable. That means they were critically and of paramount importance for the cellular growth and for the transition of the yeast into its fungal form. It's absolutely positively necessary that the yeast has this. And as I said earlier, if you deprive the candida of its food source, you can slow its growth down. You can prevent that transition from happening where it goes from yeast to cancer. That means that the sugar intake that you have control of, if you're concerned about this, what you've got to do is you've got to reduce it and eliminate it as much as humanly possible. It's entirely up to you. Okay, that's one of the ways that you can go ahead and you can turn the tide of a yeast infection in your body. Now, what I want to do is to take a closer look at some of the other methods that you can use to correct this situation. If you saw yourself in that mirror of symptoms that I shared earlier on, because I want to tell you, you have a lot of control and a power when it comes to your health. As a matter of fact, you're the one who is totally and wholly responsible for your health. Not the doctor, not the drug, not the surgery. You are responsible. And the decisions that you make and the actions that you take are going to result in how healthy you can be. Because remember, as I've said, you've got to be proactive. It's a lifestyle. You've got to remain that way if you want to enjoy the best performance of your life. So diet here is a surefire way to improve the conditions in your gut. Now, with that being said, what I want to do is to tell you some of the foods that you need to eat more of, or just start eating, period, if you're not, if they're not part of your diet every day. All right. So these are some of the things, the non-starchy vegetables. Vegetables are good, but you want to get the non-starchy ones like artichokes, broccoli, the cruciferous vegetables, celery, eggplant, kale, onions, spinach, zucchini. Those are non-starchy vegetables. Then we're talking about the sugars. We talked about the vegetables. Let's move to the fruits now. You want to go to low sugar fruits because, you know, during this time, you are going to have a sweet tooth. You are going to have a craving for sweet things. So let me recommend to you the low sugar fruits. And you may be surprised what's on my list, but avocado is first and foremost. I know you might be thinking, well, I didn't know that that was a fruit, but it's listed as a fruit. And avocado is great. You can mix it into your salads. You can put it with your eggs. You can slice it on your sandwiches. I mean, there's a lot of different ways to go ahead and ingest avocado. Lemons and lime. Squeeze it into your water every day. The lemon one day, the lime the next, and then a combination of both on the third day, and just mix it up like that. The green olives, those are very good. And then as we move on with the grains, the non-glutinous grains, you know, we're hearing about the gluten-free foods. Well, when it comes to the grains, if you like to ingest grains, my recommendation would be buckwheat or millet or oat bran or quinoa or teff. Those are the grains that you'd want to look to. And your proteins, let's not forget them. The healthy ones, the eggs. Oh my gosh, eat the eggs, see? And you can eat them, you know, in the morning for breakfast, as many as you want. Eat them hard boiled, cut them up in your salads, the omelets with the veggies that I mentioned, all kinds of ways. And also with the proteins, the herring, the fish, the herring and the salmon. Those are two very good sources of protein for you. And some other ones for the probiotics. When you put that into your system, you can find these in the dairy section, the kefir and the yogurt. Now, when I talk to you about the yogurt, I'm not talking about the fruit-laden yogurts. That's basically sugar. It's saturated with the syrup in it. You don't want that. Look, if you want the fruit in your yogurt, then add the fruit to your yogurt when you get it home, but don't get it already pre-made. And the yogurts that I would recommend would not be the low-fat or the no-fat yogurts. Now, it's going to take a little bit of researching and investigating, but you want to be a very wise consumer. So the yogurt that I'm recommending, or the yogurts that I'm recommending, are the full-fat yogurts, one of which would be Greek and another would be the Bulgarian yogurts. Those two are the top two that you'd want to seek out or search for. And then also the low mold nuts and seeds. You've got to understand that there are many nuts that we eat that have mold associated with them, and that just fuels the fire, so to speak. So some of which you can chew on would be the almonds, flax seeds, the hazelnuts. Those are very, very good nuts, and they're very low in the molds as well. Now we look to the flavorings like the herbs and the spices, the condiments, and we'll talk about those condiments too. Most people don't realize just how loaded with sugar they are. That's why we love the barbecue sauce and the ketchup and all of the A1 sauces and everything else. But go to the Mrs. Dash's spices or herbs and that. Also apple cider vinegar. You can use basil. You can use cloves, paprika, rosemary. Those are great to add in your foods. The healthy fats and the oils. Look, don't eat the vegetable oil, the corn oil, the safflower oil, the peanut oil. Gosh, I can't even think of them. Canola oil. What you want to use are flax oil, olive oil, coconut oil, sesame seed oil. Those are very healthy fats and oils. And if you do like sweet things, look, use this minimally at best, but don't go with the sugars. Stick with stevia or maybe erythritol. Those are the two that you can use, but you have to use them sparingly. Okay, but I will concede in that area. I know that we can't just go cold turkey here. And also the fermented foods. I mentioned the kefir, the olives, and the sauerkraut. Very, very good foods. And for drinking, of course, the water with the lemon, the lime, and the combination of the two. The chicory coffee is very good, and a lot of your herbal teas are very, very good. So those are foods that you want to eat more of. So now the natural segue would be what? It would be foods that you'd want to avoid. So of course you want to avoid all of the high sugar fruits. And they would include, to the surprise of many people, it would include bananas. Bananas are very, very high in sugar, and they're not really nutritionally intense. And by that, I mean, they don't really afford you a lot of nutritional value. So you want to abstain from eating those. Give those to the monkeys. And then also the dates and the raisins, you know, the freeze dried or the freeze dried fruits and whatnot. They're basically all sugar. You don't want to eat those types of things, and stay away from the grapes as well. And then in addition, and I know this is a beverage, but it's the fruit, any and all of the fruit juices. Stay away from those. Those are all sugar, devoid of any fiber, very, very intense in the sugar amount. Don't drink them. You've got to reduce and cut them out totally. Okay. Now, the grains, we talked to you about the gluten-free grains. Well, the other grains you want to stay away from now or avoid would be barley or rye or wheat. Okay. Now the meats, and I know this may upset some people, but you've got to stay away from meats like pork and the luncheon meats, you know, the pre-sliced packaged meats. The pork and the lunch meats, stay away from those. And the fish, boy, the tilapia, it's basically a garbage fish anyway. You want to stay away from tuna because that's very much consumed by a lot of people. The tuna salads, the tuna fish, the tuna loaves, all of that. You want to stay away from those types of fish. And also swordfish as well. Those are fish that you'd want to avoid. And the dairy now you want to stay away from or reduce the cheese. If you do eat the cheese, you want to go for the white over the yellow cheeses, and of course milk. If you like milk, then go to the nut milks like the almond milk or the coconut milk is probably the best of the bunch. Stay away, goodness gracious, stay away from the soy milk. And the dairy milk, the 2% and the skim milk. There is no such thing. Those are man-made concoctions. There is no cow that's out in pasture producing 2% milk or skim milk. So I understand what I'm saying. And then all of the moldy nuts and the seeds. Okay, peanuts especially, they have a lot of mold in them, and they're not really a nut anyway. That's a legume, but you want to stay away from them nonetheless. And the condiments, as I talked about a few moments ago, they're very high in sugar. You know, again, the sauces, the barbecue, the A1, the steak sauces, the catsup or ketchup, however you'd like to pronounce it, all of those good things. Read the label, and you'll be shocked, if not surprised, to see how much sugar is in those things. And that's what you're eating over and over again. That's why we liberally pour it over everything. The refined and the processed vegetable oils, I talked about that a few moments ago. Stay away from those things. If you're cooking, cook with the coconut oil, the olive oil. Those are very good oils to cook with. And of course, the sugar and the sugar substitutes, except for the two that I mentioned earlier, and any of the caffeinated drinks, or the sugar drinks. And of course, the alcoholic beverages that I mentioned much earlier on. So I talked to you about the foods that you want to start eating, the foods that you want to avoid. Now, if you have seen yourself in that symptom mirror, here's a way that you can go ahead and start at least to clean out some of the candida that's in there, okay? One option is a liquid-only cleanse, if you will. And all you need to do is make a vegetable broth. And what you want to do, though, is to make it from organic sources like onions, garlic, because that's one of the best, oh my gosh, cleansing agents that the body, that nature produces for the body are onions and garlic, celery, kale. I like Himalayan pink sea salt, the Himalayan pink of the sea salts, if you will, and pure water. You mix that all together and you make a nice, healthy vegetable broth. What you want to do with that is drink only the broth, because the vegetables that you added, they're going to be pretty much empty as a process of boiling. You're going to get all the nutrients in the broth, and there's not going to be any nutrient left in those. So you can just go ahead and skim it out or sieve it out and just drink the broth. And you can do that throughout your day. And you can do that, every couple days or every few days in a week if you want to jumpstart it, to get your body starting to clean out this yeast that you may be experiencing that may be in your body. And then over the next 3 or 5 days, what you want to do after you do that, of course, is to control your diet. You want to eliminate the sugars and the fruits and the high starchy vegetables and the alcohol. You're going to be eating mostly the steamed veggies that we talked about. You're going to be drinking plenty of water, because that's going to help the body in its detoxification process, which is going to clear out this yeast. Avoiding, as I said, the starchy veggies, because that's going to contribute to the sugar levels, and that's going to feed the candida, and that's going to just undo what you're attempting to accomplish. And some of those other veggies would be the carrots, radishes, beets, sweet potatoes, white potatoes. Those are all starchy, and they contribute to the sugar levels. So stay away from those. Eat the good veggies that I mentioned. And when you have those vegetables, when you steam them, you can top them with coconut oil. Very great, great tasting condiment. Or you can even use apple cider vinegar on them. But if you get the apple cider vinegar, go for the organic, get that source, even with the coconut oil. Because, we find a way to make money off of all kind of things. And some of that coconut oil isn't everything that they label it to be. So you want to go with organic in those two areas, the apple cider vinegar and the coconut oil as well. All right. So that's starting your cleanse. Now, what else can you do? Well, you can add some supplements, and the essential oils I've got to mention because that's really popular today, and a lot of people are often running with that. But, the antifungal drugs, they're commonly prescribed for the candida. Nystatin was back in the 80s when I was dealing with the patients that came to us with the yeast. Nystatin was the preference. It was the choice that was being used. I don't know. You have monostat. You have other types of drugs that are being used today, and I admit that I don't know all of what they are because that's not my area of expertise. I want a natural approach when I'm dealing with the body to allow the body to do what it was exquisitely created for, and that was to promote itself, to maintain itself, and to keep itself healthy, which it can do when it has the proper support from you and I. Okay, but many of those antifungal drugs, the yeast has become resistant to these drugs. So that's why we want to go ahead and use the natural approach. Now, coconut oil, I recommend coconut oil. You can eat it on your foods. You can eat it by itself. You can cook with it. And the reason that I recommend it is because it contains what's known as lauric acid and caprylic acid. And this has been shown to effectively kill off the harmful candida in the body. Two components of it, the lauric acid, the caprylic acid, so eat it liberally, eat it freely, okay? Another thing that some people use, and we use it from time to time, but I just mention it and would recommend, if you choose to use it, be very, very, very careful with it. And I might go so far as to say, look, if you're going to go this route, you might be best served to do it under physician supervision. And that is using milk thistle, because it does provide a very great cleanse to the liver from many, I shouldn't say all, but from many of the medications that you may find that you've taken over the years, the environmental pollutants that you've ingested via your breathing or on your skin or through your diet, and also heavy metals as well. Milk thistle is a very, very powerful supplement. But again, let me say that I would recommend that before you delve into incorporating that into your regime, you might have a discussion with your treating physician before doing that, okay? And then also vitamin C. It gives a great boost to the immune system, which is what is going to be weakened if you have a pretty substantial yeast infection. You've got to understand, it's like if you have smoke, there's got to be a fire. So if you've got a yeast infection, you've got to know that your immune system has been, it's been compromised. So we got to boost it. Now, getting to the essential oils, and when I talk about the essential oils, I'm talking about the pure, organic essential oils. I'm not talking about the stuff that you get through the big box stores or on the counters of many pharmacies and that. I'm talking about the real deal here. And you'll find that many of these are very expensive, but your health is an investment, right? When you do something to promote your health, you're making an investment. But getting back to the essential oils, the powerful ones in this situation with dealing with yeast would be clove oil, oregano oil, myrrh oil. Those are great options to help kill off the fungus and the candida as well. And additionally, I know many practitioners are using lavender oil because that also inhibits the growth of the candida, and it's very effective in preventing the spread of the infection, preventing it from becoming systemic as well. Okay. And another thing is bentonite clay. That draws out the impurity from the bodies, and it's really packed with a lot of minerals that include like calcium, magnesium, silica, sodium, copper, iron, potassium. That bentonite clay is a very, very good thing to add to your arsenal, but that, not unlike the milk thistle, I would have a conversation with the treating physician, with your doctor, so that you would know how much to use and when to use it, and all of the particulars involved with that. All right. And then, of course, the probiotic supplements. They can help to reduce the candida growth and protect you against recurrent infections. Okay. So now that I open that door, let's enter through it so that we can help you to choose the right probiotic. Because the probiotics, I know most people are aware of them. They do help to fight the candida. As I said, it will help to restore the balance to the gut. It's going to inhibit the candida growth, and it's going to help to also maintain the stomach acidity. Okay? Now, what you've got to understand about probiotics, they come in different ranges of the bacteria that they contain. Now, as a general rule, and now please don't misunderstand me. I have to make a disclaimer here. I am not treating, I am not making a diagnosis, and I'm not prescribing a particular treatment plan for the individual listening to this presentation. I'm just educating here, and I'm telling you a fact that generally the higher the count of the probiotic, the more potent or the better it is. Now, there are different types, and the one type, the soil-based probiotics, they generally have a lower count as far as the bacterial counts that they contain. However, they are much more resistant, and they have a better survival rate when they go through the gut. And what most people don't understand is that a lot of the stuff that they're buying over the counter and off the TV and off the internet, I apologize for that. These probiotics are they're very weak, or they're dead, or they're inert. They have no power whatsoever. So you're basically throwing the money down the toilet, so to speak. Okay, but the soil-based probiotics, and again, you've got to become the educated consumer here, or talk to your doctor. He or she may have that available to you, and they may be prescribed specific to your condition, which is that's my default. I go back to that. But if you want to take this into your own hands, you can do that. I'm just here to tell you how you want to proceed then, because the soil-based ones are the more resilient. They have a better survival rate through the gut. Now, if you are going to do that, the strains that you want to look for, they would be two. you'd want to look for the Lactobacillus acidophilus. That's one strain, Lactobacillus acidophilus, and also the Bifidobacterium bifidum. That's the Bifidobacteria bifidum. Those are the two strains, because both have been well researched, and they've both been shown to enhance the immune system and also to reduce the duration of or the proliferation, I should say, of the Candida overgrowth, because what you're wanting to do here is to return the ratios. You want to get that balance back of the 85% of the good or more, and the 15% or less of the bad. Okay, you got to have the bad in you. We all do, but it's when it gets out of control that it really creates the problem. Okay, so let me review here the 5 steps for the natural treatment. Number 1, what you want to do is to starve the yeast, and you do so by cutting out the sugar and the yeast-containing foods from your diet. Okay, cut them out totally and wholly. Yeah, maybe you can't do it cold turkey, so just do it little bit by little bit by little bit by little bit until they're no longer present. That's what you must do in order to be successful. Also, you've got to break down and kill the yeast overgrowth with the natural oils that I mentioned. And the natural oils aren't just the essential oils, but more importantly, the ones that you ingest, which were the coconut, the olive oil, the hemp seed oil. Those are the oils that you want to get into your body. Number 3, you want to repopulate. See, you're going through this step by step. You're starving the yeast so that it's dying. It can't multiply because it's starving, and in the process of starving, they become weaker. So when they become weaker, what you want to do is to attack them, and you want to break down the weak ones. You want to kill the weak ones off, and you do that through the using those oils in your diet, in your foods. And then what you're wanting also to do is the 3rd step. You want to repopulate your bowels with the good bacteria, with those probiotic supplements, those probiotic foods. Remember, the fermented foods are really great for repopulating the gut with the good bacteria. And those would be like the kimchi, sauerkraut, kefir, the 2 yogurts, the Greek and the Bulgarian yogurts that are full fat, and also eating or drinking the coconut milk, the nut milks as well. It's going to be very good. And or even for some, the coconut water might be considered. Also, and one of the, I guess number 4 now, the 4th step, you want to help the body's natural detox defense, and you do so by cleaning out the liver. And you do that with those supplements that I told you about. And again, let me restate that if you're going to go the milk thistle route, I strongly suggest you have a conversation with your treating physician so that you know how to proceed safely, okay? Because what happens, or what can happen in most of the instances, is that the individual experiences what's called a Herxheimer's response or reflex. And what that simply means is they get really sick. I mean, from severe headaches that knock the person out and make them want to just curl up in a ball on the floor. And I'm not being overly dramatic. They are intense, to the nausea, the fever, the flu-like symptoms, all kind of nasty things that can happen as a result of that. So that's why I recommend you have this conversation with your physician, especially if you're into functional medicine. That would be the way to go, or a wellness practitioner. They probably would be the best ones to speak to. They're going to be versed in this approach. And knowing your particular situation, they would be best able to determine specifically how you want to proceed with that, okay? And then also, number 5, the 5th step, you want to get active. You want to get exercising. You want to start breathing. You want to start getting oxygen into your system. You don't want to any longer be a shallow breather. You want to take time out where you're exercising and you're creating an oxygen deficit in your body so that you're having to breathe deeply. That oxygen is going to help to kill off and to immobilize the yeast that's in you. All right. And also, you want to get plenty of sleep. Sleep is so vitally important. That's when the body repairs itself. That's when the body maintains itself. It regenerates itself. It restores itself. All kind of good stuff goes on when you're sleeping, not just the good dreams, but it does it repairs all the damage that we put upon it throughout our waking moments. So the sleep is important, and the stress. You got to take, maybe don't take life so seriously, or even I might suggest, don't focus all of your attention on you, but start looking out away from you. There's a proverb that says, I always felt sorry because I had no shoes until I saw the man who had no feet. We always kind of invest in ourselves, and it's a woe is me kind of a situation. And I'm not demeaning the problems that we have in life. I really, don't misunderstand me, but sometimes we become overwhelmed with these things, and we find out they're not as serious as we made them out to be, and we need to be looking to help other people out in their situations. And I know that by blessing other people, you'll be blessed. By making other people happy, you'll become happier. It'll promote your health in ways that you perhaps didn't even realize. So those are some of the things that you can do. You can take control, and in your journey to restore your health so that you can enjoy the best performance of your life. Okay? So look, I just want to say thank you for taking the time to join me in this presentation. I want to thank you for allowing me to share this information with you, and allow me to say this to you. Should you have any challenges, should you have any questions whatsoever, please feel free. I invite you to contact my office, and we'll be more than happy to help you out in any way that we possibly can, because that's what we're here for, to help you to become proactive so that you can enjoy the best performance of your life. Again, thank you so very much, and may your days be filled with health, and may your days be numerous indeed. Take care.